this before. Okay, I'm
Okay.
gonna record you here too. This is for radio, and this is so I can send the audio back right away and they can put it online. I know who you are, but for the record, tell me your name.
Brannen, I'm an epidemiologist for Greene County Public Health.
All right, and spell your last name for me.
Brannen.
How many years have you worked here now?
16.
16. Okay. How long have you been crunching numbers?
For about 30 years now.
Oh, wow. Okay, you have a skill set that I do not have. Tell me a little bit about flu right now, compared to like where you're at, and then maybe compared to like last year.
That's a great question. In 2014-15 flu season, we had a very high number of flu cases. And last year, during the 2015-2016 season, we didn't have as many, and the flu wasn't as severe. This year, we're about in between those numbers, with some increase in hospitalizations, and in some cases, like Ohio had its first pediatric death last year, or just last week.
Really? Okay.
Yeah.
So the first pediatric death of the 2017 year, or
Yeah,
just
2016-17 flu season.
okay. So and that would be like October to March. Is that what you usually say, or?
It depends on the flu season, but generally the flu season cuts off definitively around the summer months, and it comes back over the winter time in the northern hemisphere.
Do you have numbers that I could do a comparison to show from last year to this year so far, or no?
Well, so far for this season, in the past 2 months, the month prior was about 25 cases per week of hospital-related emergency room visits, and now we've gone to about 35. So that's a substantial increase, and the trend seems to be holding up throughout the state as well. So we're definitely in the flu season right now.
And when I talked to Laurie, she was saying that there was a little bit of an increase, and is that from this time last year, or is it just an increase just overall?
From last month to this month, there's a definite increase, and it looks like we're going to have a slightly worse flu season than last flu season, but not as bad as the season before that.
Why, since you study all of this, what's the problem here?
Well, we have the swine flu strain, H3N2, which seems to cause a little bit of abdominal problems in some cases, especially younger kids, and in older folks above 65, they seem to have more severe cases of H3N2. So there does seem to be some age difference in how it affects people. And however, it always, if it gets bad, involves respiratory involvement. It can cause severe respiratory illness in some people, and even death. So we hope people will get the flu vaccine, because that way they won't get the flu illness. They'll just get the immunity from the vaccine.
We talked about weather, because it's like almost 60 today, and then tomorrow the bottom's going to drop out, and I'll be in my big coat again.
Right.
People were saying, does weather have an impact on this at all in the science portion?
Absolutely. For instance, in the summer months, we rarely see any flu. However, we do see a couple of cases of H3N2 strain flu, and particularly around the fairs, as you know, here at the Greene County Fair, we have some people who really go and they actually inspect the animals and make sure the sick animals don't come to the fair to spread flu perhaps to other people. And this current strain of the flu, which is swine flu, but it's seasonal influenza now, it is a new strain from last year. The predominant strain last year was H1N1, and this season, this flu strain, we had a few cases in the summer, and now that it's a little bit warmer, people are going to get out, and people will be able to transmit the flu a day or two, even before they get symptoms, and up to a week after they stop having symptoms. So if people are sick with the flu, they can transmit it as well, but they can transmit it before and after the illness. So with people being out during the warm weather, they're going to transmit a lot of flu that they don't even know they might even have. Some people don't even have symptoms with the flu. So when we talk about how bad the flu season is from a public health standpoint, we're looking at hospitalizations. But A lot of people can have the flu, especially with this type of strain of the flu, and not even know they have it and transmit to others who are susceptible. So by getting the vaccine, you can protect those, not only your family, but those people who aren't eligible to get the vaccine.
Okay, so are you saying too, like a lot of times, not only is the season happening right now, but normally when it's cold, we're inside, and so we all get the flu. And then it's nice, so then we go outside. We may not even know we have the flu, so we're transmitting it more, so therefore more people get it. Is that kind of what you're saying?
Exactly, and during the cold weather, the virus stays intact more, and it's going to be airborne longer. So the cool weather coming after warm weather does play an effect on transmitting the flu and make it more transmittable.
That's what I was looking for right there, was that it makes sense, you know, if it lives longer in the cold, but then we all get a chance to get outside and play, and we may not even know we're ill, we're coming in contact with more people. So, okay, I was going to see, I know washing your hands is still the best, getting the flu vaccine. Just talk about these people that you're seeing. You said a lot of people don't even know they have the flu. I'll ask for some definite numbers, like last month, how many cases did you have? This month, how many cases do you have so far? Some kind of numbers, or maybe in comparison to last year at the same time, or overall, how many flu cases? I would like to know those.
Well, I did say we're having about 35 cases per week in Greene County. So that's the numbers I can share right now. But I would like to talk about the treatment for flu. If you start having flu symptoms by sudden onset fever, the best thing to do is call your physician and get treatment early with antivirals, because that can limit the illness by 1 to 2 days and prevent severe consequences from flu, for example, bacterial pneumonia. I think that's the important message. We are in flu season now, so if you haven't had a chance to get the flu shot, the vaccine, get it, and if you do get the flu, get treatment.
Okay, and how long is this lasting? I mean, you said flu is more respiratory type things, the fever and things, but then you said the younger ones are getting the viral.
Yeah, they may have a little bit more abdominal pain and diarrhea and vomiting, and that sort of goes along with that sudden onset fever. And usually the fever is over 100, and that sort of differentiates it from the cold, which is more nasal congestion, but the flu can have that as well. So when in doubt, go get checked out.
Okay, and then my last question, you said 35 per week right now, and then is that an increase, you said, from 25?
That from the prior 30 days. So in the past 30 days, we've increased to about 35 cases per week.
So that would be about, you've increased by about 10 cases per week in the last month. I just want to make
Yes,
sure. You're the
absolutely.
numbers guy, not
Sure.
me, remember? So,
Sure.
okay, is there anything else? I think we've pretty much covered everything. Is there anything else I need to ask you?
I think that sort of covers it.
Okay. No, that's perfect. Larry? You good?
Perfect.
Okay, do you have any questions?